Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I'm talking today with Dr. Scott Conard, a family physician in private practice in the Dallas, Texas area, and he's developed a very innovative approach to delivering care during this epidemic that I think you may be very interested in. Dr. Conard, thanks for joining with us.
Larry, great to be with you today, and I'll be very quick because I know people are busy. But I am a big believer in group office visits. I believe that it combines the power of the subject matter expert, the provider, and family doctor in my case, with the curiosity and meeting people in place of the patient. So in this COVID-19 emergency or pandemic, we at our practice are struggling. I mean, financially, it's very, very difficult. People we don't want them coming in, and they're not coming in, particularly those that have multiple chronic diseases and things we normally would fill our office. So we've started a COVID-19 group office visit. And if you look at the slides, and I know, Larry, you're going to go through those, go ahead and go to the second slide. The goal of today's visit is to make sure that we understand what's going on with you. We have a survey we email on SurveyMonkey before the visit, and they send it back. It asks them, do you have any symptoms? What are your major concerns? What are your vital signs? To make sure that they understand how to identify COVID-19, understand why it's important to limit the exposure and risk, and ask what can we do and how we support you at Go Medical. Go stands for Game of Health. That's the name of my practice. So if you go to the next slide, you'll see that what we do is we share with them the overview of what COVID-19 versus a common cold, flu, and allergies looks like and how to distinguish between them. We then, if you'll go to the next slide, show them and go 2 slides forward what the Texas situation is with COVID-19, and that's where we are. We have people from Dallas and Denton, Tarrant, Collin County that all come to our practice. So we talk about what's going on with that. And then if you go to the next slide, just advance it until it fills up, and the last portion says fever 5.4 days. We talk to them about what happens when people get infected and how that occurs, and that before a person gets sick on day 5 and feels symptoms, on average, that's a median time, that they are actually releasing virus starting in day 1. So there's 4 days when they don't know they're sick, and they are infecting other people, and that fever occurs at 5.5 days. So how you feel is irrelevant, but what you're shedding is not. So you've got to basically go around treating everybody like they have COVID-19, including yourself. So we go through the whole natural history. If you go to the next slide, we talk about if we had done nothing, one person infecting 10, 10, 10, 10, 10, by the time the first person knew that they were sick, they would have infected 59,000 other people. So we make sure they appreciate how important it is for them to be careful about being around others. If you go to the next slide, we actually then go through the total case count and show them the graph that goes up very quickly. And then we go to different states and what we're seeing and how many people are dying. It's actually cut off on the slide I have here, but how many deaths have there been in those different areas and how many died in the last 24 hours. And we go on into the next slide where we talk about the difference between flu and COVID-19 death rate. And so why, even though they're young, we need to be very careful about that. And if you go to the next slide, what the flattening the curve means. And if you go to the next slide, what that actually plays out in Texas. And you can see that 583,000 people would have died of COVID if we'd done nothing by this modeling that's out of Stanford. 431,000, 3 months of social distancing, and sheltering in place, we're down to 9,000 is the best estimate on March 27th. So it's not a perfect model, but it really shows the importance of what we're trying to do. And we talk to them about what is important for them to realize, given that this is a serious situation. And so then if you go to the next slide, you can see that we now go into a section. And by the way, on the group office visit, I start off the group office visit by saying to each of them, first of all, I say this is not HIPAA compliant. You need to understand that what you share will be shared with other people. And that's also on the email we send out. And then I go through each of the people and ask them how they're doing. And they actually get comfortable speaking. And now at each section, I go back around the entire room. And there's anywhere from 2 to 12 people on these calls and ask them for their thoughts and concerns. And I do that at the end of every section. So now we're on the section, what can you do? If you go to the next section, I wrote a book called The 7 Healers, which is teaching people about lifestyle and self-care. And we go through a number of things like what to eat, getting rid of refined sugar and starches, ensuring protein intake, particularly for vegans and elderly, adding spices, which are antimicrobial, have antimicrobial properties, eating multiple colorful fruits and vegetables. Be careful about the fruits with all the sugar. And then if you go to the next slide, fermented foods in the microbiome, alkalinizing your body, drinking lots of fluids, getting lots of sleep, getting regular exercise, and practicing meditation and yoga. And just for fun, I encourage them to start a little garden. It could be in their windowsill or it could be out and about. And again, for those of you who are integral medicine physicians, these recommendations actually formerly came from Cleveland, the Cleveland Clinic. The gentleman who is in charge of that program sent out an email I thought was really well done. So I borrowed, benchmarked, I think is the term we use today for using similar words. I shortened them, put them in my own words, but a lot of the ideas are his. Okay. We then go into identifying who's at high risk, and many of our patients are at high risk. And so we walk through that with them, but we have the conversation with them that we had a recent 28-year-old die. We had people who are hospitalized with an ICU with intubation in Dallas that are young. So it's not just the old that are severely affected. We then talk about the preventive actions on the next slide that everybody can take, and we go through examples of someone walking in, touching your doorknob, you have to clean it, if you touch that and go touch your car, now it's in your car. And so we go through a number of real life examples of what you have to be careful about. And then we talk to them on the next slide about what to do. And that's in terms of, take good care of your chronic conditions, make sure you monitor your blood sugar, your blood pressure, other things. We will refill your medications. We'd like you to go to mail order 3 months at a time to try to avoid going to pharmacies. Over-the-counter medicines, if you need them, go one time and get them. Don't go multiple times. And then make sure you have food and household items. Try to stay in. If you get ill, please contact us. And we use a Spruce system, and we have our EMR that has a portal they can get into. And so then finally, we go back to the goals for today's visit on the final slide, and we go around the room and open it for discussion. And the presentation, as I just raced through it, that usually takes about 40 minutes, and then the conversation just flows. And it's really the wisdom of them asking the question that benefits everybody the most. And this has been very exciting for us to roll this out. A couple of other things I want to mention to those who might consider doing this. We use Zoom. It is a video medicine visit that we do collect through the email that we send out, as well as on the line, HBI. I am looking at them, and we collect all their vital signs that they self-report. We put that all in. We're in North Texas. Everybody here is exposed to COVID, so we use the code exposure to COVID-19. And I have the verbiage that describes what we went through on the visit, and we bill it as a code that is a 99213 telemedicine. It's a 95 modifier, and so we are billing it to the insurance companies. I honestly, in my heart, know that with the responses we've gotten from people, they would have gone out, they would have socially been in contact. They are not going to do that now. This really brings it home to them. And I think that we are saving the insurance company, Medicare, and our community money, lives, and time. And I'm very committed to that. And so it also is building a sense of community. We call it the part of our GO family. We're a patient-centered medical home, and we strongly embrace the relationships and the support of each other going through these hard times. So, Larry, I hope that's helpful. Would love to hear any questions that you'd have.
So I'm just very impressed. I was impressed the first time I heard you speak about this, Dr. Conard, and now that I'm seeing the detail and the thought that you've put into this presentation, I am curious. When can you give me some sense of the range of reactions, or questions that people will raise in this kind of group visit format?
Well, we are from Texas, and when I say that, what I mean is that my patients tend to be a bit cavalier and aggressive, and they don't like being told what to do. And the biggest reaction I've gotten is, "Oh crap, this is real. We need to be paying attention to this." I was not thinking about this in this proper context, and they really, they're like, "Thank you. I would not have done what you're encouraging here had I not gone through this process with you." So I really I appreciate the fact that, and that's why I say I know we're making a big difference in terms of how many people are changing their behavior based upon what we're teaching them. So that's the biggest thing I get. The second thing is I get a lot of questions that people were confused. They were confused about, and what I laid out on the 5 days after you get sick, you get symptomatic on average. So then they want to know in the 4 days before what they should do. And we go through what is an exposure and what is a close contact and what do you do in the case of each. And so it just creates a very clear understanding of what's going on, what to do, why it's important, and what action to take if something goes wrong. And so I would say there's a 60 to 70% decrease in anxiety in the people who go through it, which, as you and I both know, anxiety causes shortness of breath. That's one of the symptoms. So in Texas right now, we have allergy season. People are getting a itchy, runny nose, drainage, sore throat, cough, and they're all freaking out they've got COVID. By the end of this, they know that's not the case, and there's nothing to worry about.
Well, that's fantastic. So Michael Fine, a family physician in Rhode Island, who's a past commissioner of health for that state, he speaks about the public purpose of primary care. And I think in this epidemic, it is very clear that primary care is the front line. And if primary care can function well and effectively through group visits or individual visits, then that reduces the number of people going to our hospitals, the number of people who end up in intensive care in need of ventilators, et cetera. So what you've done, from my point of view, is expand your capacity to reach out to the people who trust you, the people who are likely to listen if they get a message from their own physician. And so I just want to commend you and your team for what you've done in this crisis situation.
Oh, well, and it is my team. I take very little credit. I have Jordan and Lauren and Joy, Dr. Ackland, and Elise, Anna, Edith. It is all of us working together to make this happen, because I can assure you, if it was only me, it'd be a mess. So thank God for team-based care. Thank God for their commitment to our patients. And we add years to your life and life to your years by empowering you to take control of your health at Go Medical.
Fantastic. So would you feel comfortable sharing your email address if people hear this podcast and they want to contact you directly?
I'd be happy to. It's Scott, S-C-O-T-T, at Scott Conard, S-C-O-T-T-C-O-N-A-R-D, and that's ARD.com, Scott at ScottConard.com. I am getting about 300 emails a day. I can't promise it'll be a 24-hour turnaround, which is my goal. I work with a lot of corporations right now, and so I've got energy companies and transportation companies and other people that I'm giving advice to, and I'm on the calls with them all the time as they identify people with COVID and they want to know what to do. So I will do my best to get back as quickly as possible, and if I can't get back to you, I'll make sure that one of the other teammates do. So if you can ask your specific question in the email, I will divvy it out and make sure we get back to you as quickly as we can. And I really respect, admire, and want to support all of you in the field that are making a difference, taking care of people. It's a scary time, and financially as well as from the health of our patients' time. So I love you all. I appreciate what you're doing, and I will do everything I can to support you in whatever I can.
Thank you very much. And for the listener, this material will be available through the FMEC website, which is www.f as in Frank, M as in Mary, E as in Edward, C as in Charles.net. this recording and others with innovative strategies to respond to the epidemic. So, Dr. Conard, thank you very much.
That's my pleasure, Larry. Thank you for doing what you're doing and bringing messages like this to the world of primary care and family medicine.